We are now in the room in my lab that is particularly designated for what we like to call pain testing. Over here, this is my thermosensory analyzer, and the heat itself, is delivered through this thermode. Okay, the thermode would be positioned on a person's arm, perhaps, maybe on their knee, depending upon the body site that we're interested in stimulating. But once it's placed, and then essentially I hit a few buttons over here on my laptop, what can happen is that the heat will start at maybe a warm, non-painful baseline, and then it will gradually ascend in increasing temperature. And I might tell an individual to click a button on this mouse whenever they first feel the stimulus to become painful. So I often say that first sensation, ouch, click the button. And that's a threshold sort of measure. I might ask them to go past when they first feel pain, right, to when they can no longer tolerate the pain, when they're no longer willing to keep going. At that point, then they click the button, and what we have there is an index of their heat pain tolerance. Another modality, one that I'm particularly fond of, is this piece of equipment here. Right? And essentially what this is called a Hokanson Rapid Cuff Inflator. And there are two pieces to this device. The bottom piece is an air compressor. So easy enough, when I flip the button, it just gets ready to compress air through this tube to this cuff back here. The top piece is a dial, and I can actually set that to inflate to a particular level of millimeters of mercury. Where your typical blood pressure cuff might be 180 millimeters of mercury, we often set this to be 240. And this piece of equipment over here, as you can see, when I pull the lid off of it, has circulating cold water. Right? And that just exactly how cold that water is a function of what I set it to be. It may be that I am looking to sort of elicit the most painful stimulus possible, yet safely. And it may be something like a 4 degrees Celsius cold water bath.
All right, whenever you're ready.
How would you rate the intensity in your hand right now?
It really hurts. 80.
80. All right. How about the unpleasantness of it?
95.
All right. So we got about a minute 25 under our belts. Okay.
I thought about taking it out a long time ago.
All right. Well, keep in mind that you can do it at any time.
All right. I'll keep going for a while.
How would you rate it now?
95.
It's up there, huh?
And probably 95 on unpleasantness.
All right, fair enough. Well, I tell you what, it's actually been 5 minutes. So at this point, for safety's sake, I'm going to have you go ahead and remove your hand. You can see how red your hand is now.
That hurt.
Yes. Yes, I got that sense. There you go.